Run out of time. Let's jump straight into our discussion questions. We have 4 questions today, and hopefully we will have time to discuss all of them. Number 1, when international students seek services from counseling center on campus, it can take up to several weeks to get a counseling appointment. You know, a few weeks wait may not seem like much. It often takes that long or longer for adults to land a medical appointment with a specialist. But such wait times can be brutal for international students who may be away from home for the first time without support network and up against more academic and peer pressure than ever before. Also, counseling centers often lack bilingual therapists. Some students may feel uncomfortable in expressing themselves in English. So my question is, what are other mental health resources that international students can use if they have psychological concerns or interpersonal or emotional problems? And the follow-up in that same question is, as a result of the coronavirus pandemic, many providers have transitioned to offering online therapy. I know all of you have some sort of experience of online psychological services. How do you feel about telepsychology or telepsychiatry? So you can share your thoughts in the previous presentations order.
That sounds like the several questions together. So I'm going to respond mental health question first, because that's something I do. Even before COVID-19, I see my patients like 10 miles and 100 miles away, and through the telemental health, through the video. So I'm very comfortable, and I'm a big fan of a telemental health, because I feel like that's the way we can reach out more patients, and more people will help for that, will get the benefit from a telemental health.
I see. So
yeah. Yeah, and so I would also like to take this chance to promote Beenthere again, because Beenthere is exactly meant to provide an alternative approach for people in need to seek mental support. So it's a good supplementary of the psychological counseling. First of all, it is real-time, on demand. So whenever you have a need, you don't have to make appointments and wait until then to go, but you can just access the website and talk anytime. And also, it can help, it's through online text messaging. So for people who are not very comfortable with face-to-face chats or even voice or video chats, then you can just hide behind the screen and use anonymous texting to communicate with our trained volunteers. And last but not least, we are composed of totally Chinese speaking communities who may have a better cultural understanding in comparison with some of the foreign counselors in schools services. Therefore, we launched Beenthere to provide a supplementary of people, and hope this can help you to seek have some help and support during your difficult times.
I see. Thanks. So it's your turn, Dr. Vuky.
Yes. So again, I'm very fortunate that where I work, we are fully staffed and bilingual. We usually speak English and another dialect. I have some doctors that speak 3 or 4 different dialects. So I encourage you, I know it's very difficult to go to your college counseling departments. However, if there is a community health center, if there's a Chinatown where you live, such like in New York, Charles B. Wang, I would start looking or asking for services outside of the college where there may be counselors that speak the native language, or be able to have a referral source. So again, in Boston, what we've done is we are a community health center that has a department of 9 people that work serving 40,000 patients, but we also have a network, a directory of all the private practice Chinese speakers. And so we are also their referral source. So I think is word of mouth, but you have to ask for help first, because you just don't know if there are potential providers out there or services.
I see.
And I agree with the COVID-19 happening now, online services, everyone is doing it right now, and is being serviced and paid for by all the insurances. I just don't know what will happen afterwards, but this is a great example of how telehealth has been very effective in reaching many more people than it did before. So
I see. Did you notice any changes from APA?
yes, APA stepped right up, especially for like students training. They manage the hours. They're reducing the hours. They're trying to get as many of the therapists out there. So, and they're allowing interns to do telehealth as well, which is something they would never have done. So there's a big push in the last few weeks. And again, I hope it will stay. I just don't know what will happen once this pandemic levels out.
I see. That's fabulous. Thank you for sharing. So now Dr. Yang.
Yeah, I echo with what panelists talked about. And as for APA, it has made the training material on telehealth free to all, so that more clinicians can have access to them and also just be better equipped to handle the transition from in-person to online therapy. And one advantage of telehealth is that it is not restrained by distance. However, psychologists are licensed by state. The Center for Medicare and Medicaid Services has temporarily allowed doctors to treat patients at rural hospitals via telehealth, even if they're out of state. So I'd like to call for a well-regulated but more flexible approach to allow therapists to see clients across states.
That's fabulous. That's great. That's really cool. So actually, I know telemental health is in its early phase of development, but I personally hold the optimistic and promising perspective for the online therapy and counseling platforms. As you said, you can, like if your license can cross states, you can deliver help regardless where, clients are. So that's really convenient. It's a big step. Okay, and then let's move to our next question. So when international students try to seek professional help, what factors do they normally look at? And the follow-up in that same question is, what should students do if they find their counselor cannot help them move along? We know that clients have the freedom to choose whether to remain in a counseling relationship, but it's not that easy to transition from one counselor to another. When I say not easy, I mean psychologically. Okay, and again, you can share your thoughts in the previous presentations order. So Dr. Xu first.
Can other speakers go first? Sorry.
Sure. Don't feel pressure to do so. So anyone want to share first?
Daniel, do you want to go or I can go?
Sure.
Okay.
Beenthere is in the peer support area, so we're not very familiar with what happens within the professional realm. However, we have done some research and survey among the international students, asking them, are you willing to go to the school's counseling centers for help? And surprisingly, a large proportion of people are not willing to do so. And the main concern is that they are afraid to leave records at the center, and they're afraid this records will affect their future academic study or future professional life. So that would be one of the major concerns of students to go against going to the school's counseling centers. And also, we've also heard people communicating with us, like they feel that some of the therapists, they are not very resonating with the Chinese culture, and therefore there are miscommunications and misunderstandings. So I think the cultural compatibility is also something students are really put high regards to. So those are the two observations that we have found in interacting with our visitors and students.
I see. Actually, I did a similar survey before. So I interviewed, like 10 Chinese international students, and I found that for those who reach out for professional help, found both language and the cultural barriers between them and the therapist. So yeah.
So
So,
just on
yeah.
top of what Daniel said, one thing my experience is, I know this is a culture is very important for us. If your therapist understand your culture, you feel more comfortable to communicate. But I think that's just the one aspect of a psychotherapy. There are some research studies show the number one important factor to affect the treatment outcome is not like language or culture, is whether or not your therapist has the empathy. So I think there are a lot of skills can overcome those barriers. I understand where we come from, what those thoughts come from, but I really encourage you, if you don't feel like you can find if you have to have a Chinese speaking therapist for you, not necessary. I think a lot of therapists, well-trained therapists, they can understand you for the very different way.
I see. I agree. I feel like multiculturally empathetic and sensitive and conscientious therapists are really necessary, not only for international students, for like in general population.
I really appreciate, Dr. Xu, you said that too. I do agree, although there have been lots of studies about ethnic match being an important factor in effectiveness of therapy, but empathy is I would say is ranked up there very high as well. And I can say personally, so the majority of the clinic, the people I see are Chinese, and I do not speak Chinese. So there are times when there is a Chinese person speaking in Cantonese or Mandarin, actually are okay seeing me with half English, some English, and then having an interpreter, because they feel that I care and I listen. And I have to tell you, there are times I didn't have an interpreter present. I went through Google Translate to do this session, and that's not preferable, but because the fact is that she said, it's okay because you do seem like you care and you want to help. And I think that was a big factor. So I encourage students, yes, that you have a right. If you do not feel comfortable with your counselor, you please move on. Do not stay with them, because that can be more harmful than good. I wanted to check in about the credentials and price. So, I mean, again, I promote like any counselor who has a mental MSW, social work, psychology, psychiatrist, as long as it's a good fit, is important. But also for price, if you go to the community health centers, most of the time they can have, if you can't use your health insurance, and it could be a fee for service, or a low cost fee, or you can look for private practice individuals that will do pro bono work. So there are people who are willing to help and to reduce the prices or do it for free. I think it's that risk of asking. And I know that it's hard to keep telling your story over and over again, but if you can find the right fit, I think it'll be very important.
Sure. Thank you so much for sharing so useful information. And
I just maybe add on to one thing. I think when students or anyone wants to find someone who speaks the same language or come from the same culture, it's because they want to be have a better chance to be understood. So it all boils down to whether the person feels comfortable with this therapist, whether they feel they can be themselves, they can relax into their thoughts and feelings without worrying that they will be judged. So I think that's the most important thing. And if someone is looking for a therapist, I'd encourage them to know that they have the right to interview the therapist, to ask for a brief consultation first, where they can ask them questions and see how they handle them.
I see. That's great. Thank you. Again, we are going to run out of time, so let's skip question 3 and go straight to question 4. So, for international students who are currently in the US, they may struggle to figure out if they should stay or go back home. So kind of increased levels of anxiety and stress. So for those students, could you please give a brief advice, like 1 or 2 sentences, like how to, stay in good spirits?
So are you talking about all international students regarding this psychological and
yeah, for international students in general, and during such pandemic, so could you please, yeah.
I can understand how challenging, how difficult to make a decision. I personally don't think there is a universal answer. I think this is really an individual case based. But one thing I want to suggest you to ask yourself, why you come over here, and I think that's the probably questions you can answer, and if you find out, I think that will help you to make a decision.
Sure, thanks. Anyone want to share?
My advice is that knowing you are not alone. So that's my biggest words. So I am also in the US, and I'm also quite concerned of the COVID-19 development. So there was once when I was feeling quite anxious and stressed, and I personally used Beenthere, try to find someone to talk to. And then the other person said, okay, to tell you the truth, I'm right now in the UK. And at that specific moment, I thought I'm healed because I'm not alone, and someone who is in an even worse situation trying to help me. So I think finding some peers who have the similar experiences and knowing you're not alone is a very important thing.
Yeah, thanks for sharing. It's insightful. And anyone want to share?
I think I echo that. I think it's so important that knowing that you are not alone, finding ally support, and even if no one can tell you, again, it's very personal, like Dr. Shi was saying, because only you know your situation, but just to say, this is just to voice it, I think, so don't internalize it, don't keep it all bottled up, but voice those fears. Again, not everyone may have an answer for you, but I think, again, knowing that other people will listen, care, and maybe in the same boat.
That's great. I feel the same way.
Yeah, I like everything that you just mentioned, because there's different perspectives. I guess if I have something to add, as I mentioned in the presentation, the more it's out of control, the more we should come back to everyday basics and take good care of them, like food, sleep, exercise, and the connection. And also, I think no matter where we are, you're going back or you stay in the US, and what you choose, there will be problems and things you don't like that come with your choices, and just have to deal with the problems when they come, and then deal with new problems when they come. And how we face and deal with all those problems is going to become our life now and our memory later.
Yeah, thanks for your thoughtful ideas. I agree. And so during this pandemic, so stay safe, stay home, wash your hands, and FaceTime your friends. And hopefully we will see the other side of this. And I could talk to you guys for an hour on this, but I know everyone wants your time. So good luck with what you are doing, and take care.
Thank you.
Now I'm hand over to E.